Sex after 50 used to seem like a radical idea. Now sex after 80 doesn't seem so strange. This is the People's Pharmacy with Joe and Terry Graydon.
The idea that older people might continue to be sexually active into their golden years might seem silly, but baby boomers entering their 60s are still interested in sex, drugs, and rock and roll. The only difference is that the drugs they're seeking are Viagra, Levitra, and Cialis.
Dr. Ruth is renowned for frank talk about human sexuality. She's about to celebrate her 80th birthday, and she's still going strong. She talks to us about sex after 50.
Coming up on the People's Pharmacy, we'll also talk with Dr. Irwin Goldstein and his wife Sue about sexual medicine and ways to overcome female sexual dysfunction.
First, this news.
In the People's Pharmacy health headlines, computer keyboards may be dirtier than you think. Most people have been told to wash their hands after using the toilet. Maybe we should institute the same rules for typing on a keyboard. A British microbiologist tested 33 keyboards in a typical London office. He also took swabs from the restroom door handle and a toilet seat. The germs that grew on the petri dishes were revealing. 4 of the keyboards harbored dangerous bacteria. One keyboard had 5 times more bacteria than the toilet seat. This isn't the first time that computer keyboards have tested high for bacterial contamination. A year ago, the Centers for Disease Control reported an outbreak of norovirus in a Washington, D.C. elementary school. A contaminated computer keyboard was suspected of spreading this stomach flu to more than 100 children and teachers. Perhaps it's time to consider disinfecting computer keyboards periodically, especially if they're shared with colleagues, and get in the habit of washing your hands after using the bathroom or a keyboard, especially before snacking.
Drug company executives are being called to task for potentially misleading TV commercials. Congress has been questioning manufacturers Merck, Schering-Plough, Pfizer, and Johnson & Johnson about ads for drugs like Vytorin, Lipitor, and Procrit. In the Vytorin commercials, high cholesterol foods were paired with funny-looking relatives. The message was that high cholesterol was due to both diet and heredity, and Vytorin would help both. Trouble is, Vytorin did not perform very well in a recent clinical trial. Another drug, Procrit, was aggressively marketed to cancer patients with the claims that it would restore energy. This anemia medicine was never approved to counter fatigue. Even though the FDA asked the company to revise the commercials, there was no action. More recently, it's been learned that Procrit and similar anti-anemia drugs have been linked to tumor growth in some cancer patients. Duke scientist Dr. Ruth Day says the commercials overemphasize benefits while downplaying risks. As a result, viewers are far more likely to remember the good news and forget the problems. It remains to be seen whether Congress will tighten restrictions on direct-to-consumer advertising. In the meantime, patients should be wary about requesting drugs they see on television.
Speaking of controversial drugs, a consumer safety group has called for the removal of a popular birth control patch. Ortho-Evra was heralded for its once-a-week convenience when it was first introduced. Nearly 3 million prescriptions were written for it last year. Although the patch uses the same type of hormones found in birth control pills, it delivers a higher dose. As a result, the risk of blood clots is greater than with oral contraceptives. That's why Public Citizen is calling for the FDA to phase out its use. The company, Ortho Women's Health and Urology, maintains that this patch is safe and effective when used according to the labeling instructions.
Several years ago, some researchers speculated that lowering levels of a protein byproduct called homocysteine would reduce the risk of heart attacks and strokes. B vitamins, especially folic acid, are quite effective for lowering homocysteine. A large clinical trial was undertaken to determine whether high doses of folic acid, vitamin B6, and vitamin B12 would prevent blood clots, strokes, and heart attacks. The results were published recently in the Journal of the American Medical Association, and they were disappointing. There was no difference between cardiovascular outcomes in women who took the B vitamins and those who took the placebo.
Obesity poses a risk for diabetes and cardiovascular complications. It can also be hard on the joints. Now add another risk to this list. Scientists at Johns Hopkins have reviewed 10 international studies and found that obesity significantly increases the chance of developing Alzheimer's disease or other forms of dementia. Being underweight may also pose a risk. The investigators note that people who are under their target weight are about a third more likely to have cognitive decline than those of normal weight. Seems like Goldilocks strikes again. The moral appears to be not too heavy, not too thin, but like the porridge, just right. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. Support for the People's Pharmacy comes in part from Duke Medicine, where quality care and patient safety are always the top priorities. More information at dukehealth.org.
Dr. Ruth Westheimer is a legendary figure. She is larger than life, which is probably a good thing since in life she's kind of short. She's 4'7", but she is a ball of energy.
And she's about to celebrate her 80th birthday in just a few weeks. She loves talking about sex. She's not bashful about discussing some of the most intimate details in the bedroom.
You know, I think we should issue a word of caution here. Our topic today on the People's Pharmacy is sex. And although there's nothing prurient in the show, we ought to warn you that Dr. Ruth Westheimer speaks frankly, as she's accustomed to doing. If that's going to be offensive, or if you have children listening, this would be a really good time to turn the radio off.
We heard that Dr. Ruth was going to be in our local community for a conference. She was a keynote speaker, but she made a little time to go by the local Barnes & Noble bookstore to do a book signing for her book, Sex After 50. At first, she didn't want to talk to us. She was just way too busy. There were so many people in the store. There's a long line, especially women out the door. Couldn't wait to talk to Dr. Ruth and get her to sign their book, but we prevailed. And we said, oh, come on, Dr. Ruth, give us a little interview.
And we promised her we'd talk about her book, too.
Of course. Well, Dr. Ruth is best known as America's sex expert. She has degrees in sociology and a doctorate in education from Columbia University. She completed postdoctoral work in human sexuality at New York Presbyterian, so she is an expert.
Absolutely. You had any doubt? I don't think so. You know, Dr. Ruth Westheimer was born Carola Ruth Siegel in Germany in 1928. Her father was captured by the Nazis, and after that, her mother sent her to Switzerland in 1939. After the war, she learned that her parents had both perished in the Holocaust. At age 16, she moved to Israel and joined an underground Jewish organization. She was a lookout and a sniper, although she says she never killed anyone. In 1980, she started a radio show called Sexually Speaking. It was a sex advice show on WYNY in New York City, and the rest is history.
Well, I'm sure everybody can recognize that voice. It is so distinctive. She's appeared on television, shows like To Tell the Truth, Hollywood Squares, David Letterman, Late Night with Conan O'Brien. She's virtually a household name, and she's been heard on radio stations across the country, and she has written all sorts of books.
Well, for example, the Sexuality Encyclopedia, Sex for Dummies, Rekindling Romance for Dummies.
And don't forget Dr. Ruth's Guide to Safer Sex, Sex and Morality, Who's Teaching Our Sex Standards. I love this one, Dr. Ruth's Guide to Good Sex, like, there's bad sex. Well, I guess that could happen.
I'm sure there is.
And then she has Sex After 50, one of her more recent books, Revving Up the Romance, Passion and Excitement. And that's where we ran into her. She was flogging her book.
Oh, that's not a nice way to put it.
No, but, she loves to sell books, just like all authors do. And she was all excited about Sex After 50, which we are, too, as a matter of fact.
Absolutely. Well, as we pointed out, Dr. Ruth has been talking and writing about sex for a very long time. And when we caught up with her at the local Barnes & Noble, we asked her if the questions she gets have changed during the past 20 years.
So I tell you what has changed. It's a very good question. The questions themselves, I have now been doing that. I'm going to be 80 in June. I've been doing it since I'm 45, 50. And before that, I taught how to teach sex education. What has changed is the vocabulary. And that's because people, like you radio people, I did the radio on WYNY for 10 years, every Sunday night. And because of television, all of the television programs, and because of other television programs. I'm not the only ones. Sex and the City, some others. So the vocabulary has changed. The questions themselves still fall into two categories. One about relationship issues and one about specific sexual issues.
Dr. Ruth, what are the most common questions that you get? You've been doing this for decades. What comes up over and over again?
When you say decades, I want you to say it with a smile. I don't want you not with a frown. The latest book is Sex After 50. So here, the questions that I do in those categories, some about relationships, such as I'm bored with my partner, what should I do? And I could never answer that on radio. I have to have them in my office. I still see about 5 hours a week in the office because there are questions you cannot answer in generalities. Then there are specific sexual questions. We are very fortunate. Here it's the year 2008, and we have less women who don't have orgasms. Because when I started, there were plenty of women, and we have scientifically validated data about that. There were plenty of women who did not have sexual satisfaction. That has changed. The other big issue that has changed, which I'm very pleased about, is less unintended pregnancies. We still have too many. And but because we talk so much more about contraception, because of Planned Parenthood, because of all physicians, centers, social workers, so less unintended pregnancies. And we are now willing to talk about sex after 50. So why am I here? My message is, anybody who has a problem, men or women, if there's a problem, go and look for help. And I know that even young people, for example, women, have to know about menopause. Because very often I get women in my office who say it's painful to have intercourse because they don't know that they have to use a lubricant. Men don't know. That's the most important message for today. Men don't know and women don't know, both of them have to know, that at a certain age, I'm not giving it an age, it can be younger or older, there is no psychogenic erection. A psychogenic erection is an erection that a man has when he wants to engage in sex. At a certain age, a man needs physical stimulation in order to obtain and maintain the erection. So if that couple doesn't know, he tried to make love, it didn't work, he doesn't want to disappoint her a second time. He's not going to try again. She has never had to touch that part of his anatomy. So she says, I never had to do that before. Why do I have to do that now? And we have scientific data that this is the way it is. So we can't even say why. We just have to say anybody who is sexually literate, anybody who knows and talks about sex, and anybody who is fortunate enough to have a partner, in my way of thinking, can be sexually active until the age of 99. Is that good for your radio?
Are you sure there's a cutoff at 99?
I say 99.
One last question, if I may. We frequently hear that there's often a difference in libido, and that men want sex a lot and women maybe not so often. How do you deal with that question?
Okay, all of you listen. Any couple, there are women who might want to have more sex than men. It's not only the men. I see some people nodding. Don't point at them. It's not a camera. It's only radio. There are women who want more and men for many reasons. busy, tired, drinking too much. There are many reasons. The mother-in-law bothers them, whatever it is. I tell these men, you do not have to have an erection in order to satisfy her. Also, people don't have to be Siamese twins. Let's suppose she wants to have it more. I say to him, give her an orgasm. You can use a vibrator. You can use you can perform cunnilingus if that's in your repertoire. You can use your hand. And then I say, you can use your big toe and make sure she has an orgasm. Now, what your partner here said, your partner on radio, he said...
He's also my partner in life.
Okay, so what your partner in life said, mostly it's men who want more. If I get a question like this, I say to the women, come here. I'll tell you a secret. Come here. The secret is, big deal. It takes 2 minutes. Give him an orgasm. Either with your hand or perform fellatio or rub against him. It doesn't have to be simultaneous. If it happens simultaneous, you look at each other, you get sexually aroused, wonderful. It doesn't have to be that way. And we have to teach that. We have to say the libido is not equal for all people at all times. The important thing is to have a relationship with each other that is so productive that people can talk about it and that people can make each other happy. That's the message for today. You like that? Thank you so much. Thank you.
Well, and thank you, Dr. Ruth. You've been listening to Dr. Ruth Westheimer, America's best-known sex expert. Her most recent books are Dr. Ruth's Sex After 50, Revving Up the Romance, Passion and Excitement, and Sex for Dummies, the 3rd edition. You can learn more at drruth.com.
We're going to talk with Dr. Irwin Goldstein and his wife, Sue Goldstein, in just a few minutes. He's editor-in-chief of the Journal of Sexual Medicine and director of sexual medicine at Alvarado Hospital in San Diego, California. Sue Goldstein is sexual medicine education coordinator and co-author of the book, When Sex Isn't Good, Stories and Solutions of Women with Sexual Dysfunction. We'll find out about some of the most common sexual problems couples have to deal with.
The People's Pharmacy is brought to you in part by Duke Medicine, bringing patients the newest therapies and the benefits of the latest research. Extraordinary people, extraordinary care. More information is available about Duke Medicine at dukehealth.org.
You're listening to The People's Pharmacy with Joe and Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utter Cream, utterly smooth hand and body lotion, and Country Cream. They're aids for dry, chapped skin. The number is 800-345-7339. The website is uttercream.com.
And by Blue Lizard Australian Sun Cream, providing high protection against both UVA and UVB sun exposure, and the new Blue Lizard Sensitive with zinc oxide for delicate skin. The number's 800-334-4286 on the web at bluelizard.net.
If you'd like to order a CD of this show, you can call 800-732-2334. This is show number 680. Or you can find it on our website. It's peoplespharmacy.com.
And today on the People's Pharmacy, we're talking about human sexuality. You know, there are sexual messages everywhere on TV and movies, music, on the internet. But a lot of people still have trouble talking about their sexual issues, even with their partners, and definitely with their physicians.
To help us deal frankly with these issues, we have a husband and wife team with us today. Sue Goldstein is Program Coordinator for San Diego Sexual Medicine, with responsibility for patient and provider education. She's also editorial assistant for the Journal of Sexual Medicine, and she's co-author of the book, When Sex Isn't Good: Stories and Solutions of Women with Sexual Dysfunction. Welcome, Sue.
Thank you, Terry. I'm pleased to be here.
Also joining us from the studios of KPBS in San Diego is Dr. Irwin Goldstein. He's been involved with sexual dysfunction research since the late 1970s. He's editor-in-chief of the Journal of Sexual Medicine and director of sexual medicine at Alvarado Hospital in San Diego, California. He's also clinical professor of surgery at University of California at San Diego and director of San Diego Sexual Medicine. Welcome, Irwin.
Hey, Joe and Terry. Thank you so much for doing this.
Well, we're delighted to have you with us.
Sue, over the last 8 years, we've spoken several times with your husband, Irwin, about sexual medicine. It's nice to have you joining us. Do people raise their eyebrows when you tell them about your work, or has the topic of sex finally become accepted in mainstream society?
I think it really depends who you're speaking with. There are still segments of people that are not comfortable openly talking about sex, are happy with their sex lives being non-existent, and that's perfectly acceptable. And there are other people who say, oh my gosh, I'm so glad you wrote this book because there's such a need for it. There's so little information. We women deserve quality sex lives. We deserve care. We deserve attention.
Now, Sue, you focus on women's issues in this book, When Sex Isn't Good. And I guess a lot of our listeners would like to know, what are the most common complaints around female sexual dysfunction?
The most common complaints seem to be women who have no interest in sex and typically will have a spouse who is interested, and so they become very frustrated because they want to have the interest, they want to be able to have successful sex with their spouses, but it's just off the radar. I mean, it doesn't exist in their lives anymore. The other issue is that they are having sex, but it's not fulfilling. They aren't able to be aroused easily. They're not reaching orgasm. And what fun is it to lie in bed and have no sexual satisfaction? Those, as far as I'm concerned, are the most common presentations. But Irwin can actually address that better in terms of the patient population he's seeing.
Well, then we'll ask him to do that.
Irwin?
I'm totally enjoying listening to this.
What are the problems that you see most frequently? Are they the ones that Sue has reported in her book?
I think that in our practice currently, low interest, what we call HSDD, hypoactive sexual desire disorder, and women who have excruciating pain or bad discomfort during sex, so sexual pain disorders, are the two ones that we see most common. Women who can't have orgasm or have muted forms of orgasm would be the third most common.
Well, speaking of problems with orgasm, we got a letter a couple weeks ago that I would like to read to you, and you can tell me if there's an answer. She says, I'm an 81-year-old woman who continues to enjoy having sex with my 85-year-old husband. My only prescribed medication is Inderal for essential tremor. I'm in excellent health, walk 45 minutes daily, eat healthily, and keep my weight down. My problem is my inability to achieve an orgasm. Could age figure in this? She says, up till now, I've had no problem with this.
Both men and women, as they age, develop this difficulty with orgasm. It's in part biologic, it's in part psychologic, and as it is with any patient, they would need a full evaluation. We now have new drugs that are helping men and women have orgasmic response, and if she's interested, there are certainly ways we can help her achieve orgasm.
What are the drugs?
We currently prescribe, along with sex therapy and, if needed, physical therapy, we would use androgens like testosterone would be helpful. We would use dopamine agonist therapy. An example would be bupropion. or Wellbutrin, and now we're using alpha-2 receptor blocker therapy, which is yohimbine, which has been found to be really helpful in men and women with orgasmic disorders.
Now, you mentioned yohimbine, and you gave it a nice fancy pharmacological term. But this is an herb that has been used in Africa for decades, if not centuries.
Well, it's an herb under the name yohimbe. It's a drug under the name yohimbine hydrochloride, which is actually FDA approved, and under the name Yocon, Y-O-C-O-N, and it delivers 5.4 milligrams of the actual pharmaceutical product yohimbine hydrochloride. So it's different than the herb that you bring up.
But it's been around for a long time and has a long folklore associated with it.
Yes, in dosages approximating 20 milligrams an hour before sexual activity, published data support the fact that approximately 60% of people who can't have orgasm will be able to have orgasm while using this product. And that's our experience clinically as well.
I'd like to turn the conversation back to Sue. Sue, you include your own story in the book. Would you tell us about your experience, please?
Absolutely. I was perimenopausal, and sex was no fun anymore. It was very hard for me to become aroused. It felt like it was work. I went from being a multi-orgasmic person to someone who only reached orgasm on rare occasion, and I was allowing my husband to fall asleep at night. I wasn't avoiding sex per se. I just wasn't encouraging it because it wasn't fun. And I assumed, okay, my husband is turning 50, and at 50% of men have erectile difficulties. How was I going to tell a man whose life is sex? I mean, you may think that Joe thinks about sex a lot, but my husband makes his living thinking about sex. How was I going to tell him he was having erectile dysfunction? So I basically avoided it. And one day he came home with a validated questionnaire, which means it's a question and answers that you would give to a patient to determine their sexual health. And he said, take this for fun. This is what I'm giving to the women now. And I took it. And he looked at the answers and he goes, holy, I won't say it. You have FSD. And it's the first time that either one of us had any idea there was anything wrong with me. I had been frustrated about sex. I had been distressed about it, but I hadn't brought it up because I didn't want to distress my husband. As soon as I saw that, I realized, oh my gosh, it's me, it's not him, and what are you going to do to help me? That is actually why I wrote the book, because I was so immersed in the field, and yet I had no idea anything was wrong with me. And I thought, if I don't know, how will other people know? So I did get the blood tests, and at the time I needed androgens, and I started on androgen therapy. And as I aged and reached menopause, my medications had to be adjusted. And I have to say that I'm 58 years old. I won't hide that. And I have a very wonderful sex life. What I like to tell people is when you're in your 20s, sex typically, and unfortunately for a lot of women on birth control pills, they have issues. But for the rest of the 20-year-old age group, they have great sex. So for women in their 20s, sex is great, but they may not be comfortable saying to their partner, touch me here, do this, don't do that. They're in their 30s, they're raising young children, they're trying to develop their workplace position. Sex is not even on the radar. They're in their 40s, their children are teenagers, or they're successful in the workplace, traveling all the time. Now they're in their 50s. Children are out of the house. They've established themselves at work. They want to have a great sex life, but suddenly their body biologically isn't working. Help. You don't spend your whole life so that you can be a dud in the bedroom. Enjoy your sex, and there's nothing better than having lived your life and now being comfortable saying to your partner, I like this, I don't like this, and you light the candles, you turn on the music, and you enjoy your evening.
Now, Irwin, you've been working in the field of sexual medicine since the 1970s. So here's a question for you. How did you get interested in sex? You were a urologist, right?
Actually, I was a biomedical engineer from Brown University. Fluid flow, I think, would be the one answer. And the other answer was my chairman in urology placed penile implants. He actually learnt from the inventor of the penile implant, who developed it in 1973. He learnt from the inventor in 1974 and became one of the first penile implanters east of the Mississippi, and did this work in the 1970s. So that's when I was training. So we actually had in the office men who had sexual problems. And I don't know if you recognize the time. That's the Masters and Johnson era. That's the psychologic era. That's when having a man with a sexual problem in a physician's office in a hospital, that was a unique and odd concept.
Well, I can certainly see, however, how the background in biomedical engineering and the confluence of penile implants might have gone well together.
It was absolutely a perfect mix. We went straight to the laboratory asking the questions, what causes an erection, what causes an erection to go wrong. We went to the animal model, we started learning, and we ultimately identified the chemical that is released by the nerves during sexual arousal, and that ultimately led to the Viagra experience.
Well, speaking of Viagra, I mean, we are basically at the 10th anniversary of that drug, which has really revolutionized the way people even think about erectile dysfunction and sexual problems in men. But we don't have pink Viagra. We don't have a drug for women that has been approved by the Food and Drug Administration. You've mentioned androgens, male hormones, but there's not a particular medicine that has actually been promoted directly for the use in women, and that leads to a whole nother can of worms. And that is this whole politics of female sexual dysfunction, FSD as it's been called. There are some people who say, Sue, that this is an invention of the drug companies, doesn't even really exist. How do you respond to them?
Well, I would say to those people, talk to the women who call our office asking for help. The women who the day Viagra was released said, okay, you've got something for men, they can take, what have you got for us? Talk to the women who are featured in our book. Talk to the women that we see. There are women out there who are not interested, and that's fine. But for those women who know something changed in their bodies, my co-author gave birth at the age of 29, knew immediately her body had changed. She was sent to a sex therapist for help, and she said, I didn't wake up one day and find my body feeling different because something happened to me mentally. While we don't negate the psychologic issues in sexual dysfunction, you can't negate the biologic issues.
And obviously childbirth is a pretty major biological event.
Absolutely, and we know that women, not all women are affected by childbirth, but women can have their biology changed by childbirth, and by the birth control pills, and by so many other medical issues that can change their hormonal milieu.
Well, you mentioned the psychological, and let's come back to that, because obviously sex is very complicated. It's not just hormones. There's desire, there's the psychological, there's the mental. I mean, people have said the biggest sex gland in your body is between your ears. So how do you all bring the issues of romance, psychology, together with the hormones and the physiology?
We do have a sex therapist in our office. So when our patients come, they're given a biologic and a psychologic assessment. I think one of the things people have to realize that why there is a huge psychologic piece for this, for sexual dysfunction in men and women, the psychologic may not necessarily be the primary cause. It may be a result of the biologic cause. And so that's why we provide assessments for both. And when you talk about the biggest gland being between your ears, that may be true in more ways than one, because now the investigations are looking at biochemicals in your brain. So something can be in your brain and not necessarily be in your head, if you get what I mean.
So it may be in your brain, but not psychological.
Well, right. I mean, it may be a biochemical imbalance, which is causing a physiologic response, which then results in psychologic trauma because it affects your relationship, it affects how you think about yourself. So we need to address both the biologic and psychologic concerns of all patients.
You mentioned neurochemicals, biochemicals in the brain, and there might be drugs that interfere with sexuality. And one that comes immediately to mind, Dr. Irwin Goldstein, is Prozac and all of its chemical cousins like Paxil and Zoloft. These are the so-called SSRIs, the selective serotonin reuptake inhibitors, that do mess with our brain chemistry a bit, and they throw a monkey wrench into our sexual machinery. How does that happen exactly, and are there other drugs that also interfere with both male or female sexuality?
Those are great questions, and in listening to the conversation you just had about what's in your brain and what's in your head, this all relates back to depression. In depression, you can be psychologically depressed, but you can be biologically depressed with an upset of the chemicals in the brain. The SSRI drug class raises the neurotransmitter serotonin, and serotonin would help with someone's depression, but serotonin is one of the most potent inhibitors of sexual activity. It is one that makes one less interested in sex, have less orgasmic potential, have less arousal. So that is clearly something that needs to be dealt with. And there are people who, in fact, walk around with too much serotonin, who have poor sexual interest, who don't have a psychologic basis for it. It would be a biologic basis. And that's the beauty of our field. It is complicated, and it is being understood more and more with time. It's the new class of drugs that will help men and women with sexual issues are CNS drugs, drugs that work in the central nervous system, as opposed to, say, Viagra, which works in the periphery.
Can you tell us a little bit more about some medical conditions or treatments for medical conditions, for example, high blood pressure, that may interfere with sexual function?
Well, you just mentioned drugs that are antihypertensive would have effects on libido and on blood flow. We talk of women who are becoming older as they're undergoing childbirth, so there's this big class of treatment called infertility, and many of the infertility drugs really create havoc on the sexual response. The oncologic therapies pretty much are anti-sexual. Men who have erectile dysfunction are creating sexual dysfunction in women, so there's just many things that are affecting women's sexual response.
Well, that actually brings up an interesting issue. You mentioned that the partner's erectile dysfunction is a problem for the woman's sexual pleasure, for sure. When a couple is having a problem, it is a couple problem. How does a couple decide which one of them needs to go in for medical workup or for counseling? I assume that erectile dysfunction might be real clear, but then again, maybe it's not.
Well, not just erectile dysfunction, but premature ejaculation can certainly rob a woman of her satisfaction during sexual activity. It would be ideal, as we manage men and women with infertility, that they both go together as a couple. The ideal way to manage a sexual problem would be to come in as a couple. We strongly encourage that, and we could then get out the issues of aging and the issues of therapies and engage both partners.
Okay, well, when we come back, we're going to find out how drugs for erectile dysfunction may affect women. No doubt they've been used to restore a strong sexual relationship in some cases, but can they also put unwelcome demands on a partner who might not be that interested or up to the challenge? All that and so much more coming up on The People's Pharmacy.
You're listening to The People's Pharmacy with Joe and Terry Graydon. The People's Pharmacy is brought to you in part by Freeleaf, the non-drug way to prevent food acid symptoms safely without interfering with your stomach's own protective acid. That's Prelief, Freeleaf. The number's 800-994-4444. 4711. On the web at groove.com.
And by Red X Industries, makers of Utterly Smooth Foot Cream, now with shea butter. Helping dry, cracked feet feel soft and smooth. The number's 800-345-7339. The website, buttercream.com.
If you'd like to order a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 680. Or you can find it on our website. It's peoplespharmacy.com.
And today on the People's Pharmacy, we're talking about solutions for sexual health.
Our guests today are Dr. Irwin Goldstein, editor-in-chief of the Journal of Sexual Medicine and director of sexual medicine at Alvarado Hospital in San Diego, California. He also directs San Diego Sexual Medicine, his clinic. Sue Goldstein is program coordinator for San Diego Sexual Medicine. She's responsible for patient and provider education. She's an editorial assistant for the Journal of Sexual Medicine, and her book is When Sex Isn't Good: Stories and Solutions of Women with Sexual Dysfunction.
Now, speaking of stories, we normally think about the man has the greater sex drive and the woman is sort of tolerating it or complaining about it or maybe just ignoring it. Here's an email that we got not too long ago that is completely different. She says, I have a much higher sex drive than my partner, who is in his late 30s, while I'm in my mid-20s. I'd prefer to have sex every couple of days, while he's fine with having it once every week and a half. I find it difficult to deal with this situation because, as a woman, I feel like it's not normal to have the higher sex drive, and I worry that I might make sex seem like a chore to my partner if I ask him to have it with me more often. What about a situation like that, Sue?
Well, she obviously has two choices. She can either self-stimulate, if that gives her pleasure, or she can sit down and have a real conversation with her partner, explain what her issues are, and if he feels that he would like to be able to make her happy and pleasure her more often but just doesn't have the interest, he may want to have an assessment. I mean, to me, a week and a half of having sex is not that unusual, but for a 30-year-old, it may be, and he may have a low sex drive. He may want to go and have an assessment and see if his hormones are normal or not. But I think the first thing they really need to do is to sit down and have a conversation.
But, that's not so easy. I mean, here she's saying, I feel like I'm a little odd. It's like I'm a woman with this active sex drive, and my partner, he's just not coming close. So, Irwin, how do you get people to talk about issues that are oftentimes very, very difficult to discuss?
Joe, you always bring up great topics, and you brought up the concept of drugs new on the horizon. So, in fact, there is now a new drug that they're testing for men who have this condition, low interest, and it's very exciting. A company that's developing this has done research, and in focus groups, this woman who says she's all alone, she's the person with the higher interest. In focus groups, they're approaching 25% of couples will say that the woman has the higher sex drive than the man. So it's not as unusual as you would otherwise think.
Now, to turn the tables the other direction, we do hear quite frequently from couples where he says, she just isn't as interested as I am, not by a long shot. So this new drug that's being developed for men with low sexual interest, will it work for women, or do we have no idea?
Well, Joe brought up the issue of the pink Viagra. If God is good, the company that's developing this product will actually submit in the year 2008 on the so-called 10th year anniversary of Viagra. And this should pass FDA, hopefully, and we'll have the first drug for women in 2009. It's actually being developed first for women, premenopausal women. It's non-hormonal, and it's a drug that acts on the central nervous system. So this will be the first CNS drug for men or women with sexual health issues. And its action is that it lowers serotonin, raises dopamine, and raises norepinephrine. All three things act to facilitate the sexual response.
Do you have a name for this drug?
The name is called flibanserin, Flibanserin, and it's a very exciting compound.
Now, Irwin, you can't help but turn on the television and almost always see an ad for one of these drugs, Viagra and Cialis and Levitra. The question that has come up repeatedly is if these drugs are sort of taking men who are in their 60s, 70s, or even 80s, who had kind of given up on sex, and all of a sudden they're excited about the idea again, but their partners are saying, well, wait a minute. I was real happy the way things used to be. Now, what am I going to do? I may be suffering from vaginal dryness. We haven't made love for 3 years. What's a couple to do?
So in that case, the woman has to make a decision if, in fact, she's going to work with the husband to increase her sex life or explain to the husband that this is the new reality. She's sort of sexually retired and he needs to adapt and adjust to that. If there is discussion and if there is distress and if there is desire to change the woman's sexual function, she should need to undergo an evaluation. It would involve seeing a psychologist and a sexual medicine physician who could then do a physical examination, confirm the dryness, obtain blood test levels, neurologic testing, vascular testing, and then see what was wrong. If, in fact, the woman had hormonal changes, which would be quite expected given her age, then therapies that would involve things like hormones, things like dopamine agonists, things like, and we just talked about drugs for erectile function. Women who are having normal hormonal values for testosterone will respond, in fact, to drugs like Viagra. So we have opportunities to help women with sex therapy, physical therapy, and drug therapy, and put together a plan to help people have better sex lives.
Sue, I'd like to get back to your book for a moment, if I could, titled When Sex Isn't Good. And we've talked a lot about women who complain that they just don't have much libido or desire. You have Olivia's journal, in which you talk about a woman who had persistent sexual arousal syndrome. And she says that if I have to live like this for another 40 years, it's a complete nightmare and something I refuse to face. She's taken good care of herself, but now her sex drive is a tyrannical, unrelenting, hyped-up caricature of normal, 24/7, 365 days a year. For her, it was hard to concentrate on anything else. Can you explain what this persistent sexual arousal syndrome is and what can be done for it?
Well, I can't explain it totally because nobody totally understands it. And Irwin can explain what the hypotheses are a little bit better. But first, let me backtrack a little. It's not that she has unrelenting sexual desire. She has no sexual desire. Her body is constantly aroused. She has that tingling in her clitoris, that constant sensation of she needs to have an orgasm. And she may masturbate, in this case she did, or she had sex with her partner in order to relieve that tension, and that relief only lasted for a very short time. And as she aged, she was no longer able to reach orgasm, so she couldn't even have relief. But it's not associated with any sexual desire. That is what's so hard with this syndrome. It's a constant biologic arousal. She could get aroused from sitting in a car, the vibrations of a car, the vibrations of loud music, the vibrations of an airplane. And it's such a constant feeling of being at that brink of reaching orgasm and never able to get over that hump that it becomes such a focus you can't focus on anything else. And that's why it becomes so debilitating. It's not that her whole body is in pain. It's not that she's always thinking about having sex. She needs the physical relief so that she can focus on other things in her life. And we have seen a whole spectrum of women with this syndrome. And it can be anywhere that they just have the problem for short periods of time or for longer periods of time.
Can you tell us how Olivia addressed her problem?
Well, in her case, it was rather unique. She had suffered from depression all of her life, and she became suicidal because of this problem. And in desperation to save her life, she actually had electroconvulsive therapy, but in a safe way by a specialist in this field. And they found that in dealing with that to save her life from the depression, that it actually stopped temporarily the persistent sexual arousal, and then over time it actually got it under control. This was unique to her situation, but I think from a medical point of view, Irwin may be better able to address this.
Irwin, please go ahead and tell us what can be done for a woman with persistent sexual arousal disorder.
Before I answer that, I just want to get back to your statement of drugs that interfere with libido and women who have low libido. We talked about the SSRI and the elevation of serotonin. In essence, this is an issue of when women have low interest, they have too high chemicals in their brain that inhibit. Let's just flip the coin to the other side. Women who have lack of inhibition, chemicals that won't inhibit are not there anymore, and essentially they have unopposed excitation. That would be the conundrum of PSAS, the persistent sexual arousal. They lack inhibition, whereas a woman with low interest would lack excitation. And it's this spectrum that is so very interesting. So we would treat currently, women with PSAS would undergo a classic evaluation, psychologist and biologist. We would see if there were physical reasons. For example, we've seen women who have arterial venous malformations or little tumors of arteries that actually send excess blood flow to the genitals, so we could deal with that with embolization. There are women who have veins in the vagina that are varicose-like. We call it pelvic congestion syndrome. We could embolize those veins. So there are some physical reasons for this. In the history, if they take a drug, trazodone, that can cause this syndrome. Stopping the trazodone can relieve this syndrome. For the run-of-the-mill PSAS patient, we typically would provide the concept of a dopamine receptor blocker. And one of those drugs, interestingly enough, is a drug that's currently approved for people to stop smoking. And the name of the drug is Chantix. And we have identified a group of women with PSAS who actually lower their symptoms with this dopamine receptor blocker. We've also had a new group of women who have had arthritis and pain who've taken a drug, tramadol hydrochloride, or Ultram. And Ultram is an opioid receptor blocker, and in fact, some of these women have their PSAS under control with Ultram. So now in some women, we're combining actually the Chantix and the Ultram to deal with this. But in essence, we're just manipulating this excitation-inhibition equation.
Irwin, I'm so glad that you mentioned Chantix because I have an email from one of our readers who says, the biggest problem I've had since I took Chantix is my sex life. The second I let myself have an orgasm, I start getting the most incredible headache anyone could ever imagine. It hurts so bad, I break down in tears. My doctor said he didn't think that Chantix is the cause, but my husband and I are sure it's the Chantix.
It's interesting. I haven't heard of that, and we have lots of people on Chantix, so I'm not... I will listen to the patient. There's a thing of orgasm-induced migraine, and I wonder if that's the cause. And we have strategies for that. We would give a vasodilator like a Viagra, and we would use a drug like Neurontin and for orgasm-induced migraine. And it sort of sounds like that.
You know, speaking of medical conditions, thyroid is one of those conditions that sometimes doesn't get as much respect as it deserves. But the thyroid gland can affect sexuality. Can you tell us how and what needs to be done if the thyroid is not working as it should?
Well, it's actually both ways, Joe. It's when the thyroid is not working too much, that's called hypothyroidism, or when it's working way too much, like in a goiter, hyperthyroidism. Under both conditions, you can have people have low sexual interest. You can have people have either early ejaculation or absent ejaculation. So we actually had an 81-year-old talk about absent ejaculation. Part of her evaluation would be to measure her thyroid-stimulating hormone, TSH, to see if, in fact, thyroid would be a player in the condition. We have data now in, I think it's something like 50 men and women with thyroid problems, that when we adjust and correct the thyroid problem, the sexual problem returns to normal. So that's very exciting information.
I do want to ask you, Irwin, to tell us about your research on oxytocin. Now, oxytocin itself is a hormone. I recall that it is used right after childbirth sometimes to help the uterus kind of tighten up. What's it being used for in sexual medicine?
Yes, and you correctly point out that it is a natural substance. Oxytocin is synthesized as a drug called Pitocin, which is intravenously administered to help the labor experience, and many women have been exposed to it and have used it quite well. The blood testing at the time of the sexual response cycle as men and women are approaching orgasm, the one blood test that uniformly changes during orgasm is the level of oxytocin. There's something about this marker that predicts the development of the response called orgasm. So some very inventive physicians have sent data to the Journal of Sexual Medicine whereby they've taken the drug Pitocin, exchanged it for the intravenous form to a nasal spray, and as the person who has anorgasmia is having sexual activity, and as they're approaching the mountain climb but just can't seem to get to the other side or to the top of the mountain, we have had experience now by nasal spray administration of oxytocin to allow that person to ultimately achieve orgasm. It's a novel context, and we hope to get more experience, but we need to help men and women who have anorgasmia. It's a big problem.
You talked a little earlier, Irwin, about premature ejaculation, and this is not an uncommon problem. And Sue, it affects women as well, doesn't it not?
Well, it affects women in that their partners have premature ejaculation. The woman may feel that she's not able to reach orgasm because there's something wrong with her. And it may be that her partner ejaculates so early that she just hasn't had enough stimulation.
What can be done?
Go with her partner to a sexual medicine facility and have a full assessment.
Absolutely. We need to address his premature ejaculation to take care of her lack of orgasm. Then we'll have them both all tuned up perfectly.
And really, that's the motto of everything we've been talking about today. This needs to be a conversation between the partners, and then they need to find a health professional who can really make a difference. Well, that is all the time we have. Thank you so much for listening to the People's Pharmacy, and thanks to our guests.
Sue Goldstein is Program Coordinator for San Diego Sexual Medicine. She's responsible for patient and provider education. She's also Editorial Assistant for the Journal of Sexual Medicine and co-author of the book, When Sex Isn't Good, Stories and Solutions of Women with Sexual Dysfunction.
We've also been talking with Dr. Irwin Goldstein, one of the country's leading experts on sexual medicine. He's editor-in-chief of the Journal of Sexual Medicine and director of sexual medicine at Alvarado Hospital in San Diego, California. He's also clinical professor of surgery at University of California at San Diego and director of San Diego Sexual Medicine.
Lynn Siegel produced today's show. Robin Copley is our technical director. We had engineering help from Tim Felton at KPBS. Peter Bombar is our technical production supervisor, and we had editing help from Dave Graydon. Our web wizard is Sarah Ovenall. Mei Li Shi is our medical information specialist for the web.
The People's Pharmacy theme music is by B.J. Liederman, and if you'd like to order a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 680. That number again, 800-732-2334, or on the web at peoplespharmacy.com.
And when you go to the website, you can find out about prescription drugs and herbs and our favorite home remedies. You can sign up for our free weekly email newsletter or listen to a podcast, and even check out our video about common health problems. All that's at peoplespharmacy.com.
And, of course, we'd love to get your comments and your questions. So if you've got some perspective on sexual medicine, we'd love to hear about it. If you've got a question for the Goldsteins, we will pass it on to them. All of that can be found at our website, www.peoplespharmacy.com. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks so much for listening to the People's Pharmacy, and please do join us again next week.